So we're just going to go through each thing one at a time. And so we'll start with where we play peekaboo with the light. Ready? Peekaboo, peekaboo, peekaboo. Good girl. And we just look right at that light. Good job. Peekaboo, peekaboo, peekaboo. Good girl. And again, here it goes. Oh, oh, look at that. Good girl. Very nice. Now we're going to do this one. Ready? Here we go. Okay, Mom, you want to hold your hand for me, please? And here we go again. Here we go. Sarah! Sarah! Okay. Good girl. Over here, Sarah. Over here, Sarah. Good. And we'll pull something else out. Ready? Okay. Here we go. Here we go. Here. Good girl. And here. Good girl. And down there. And up here, Sarah. Good girl. Here he comes. Sarah, look. Good. Yes. Ready? Here he comes, Sarah. Here he comes. Here he comes. Here he comes. Good girl. Very nice. Ready? Look at this one. Yeah, look at it. Yes, which one are you going to take? Good girl. Let's get another one. I'll do this one. And then she does this. Right? So... Ooh, good. And then I need to change hands. Ready? Here we go. Oh, once you touch it, you're too interested. Let's do it again. Ooh, and again. Sarah! Sarah! Here we go. Ooh, yes, very good. Oh, hard. Ready? Peekaboo. Look right here. Good girl. Nice reflexes. Good job. Let's look at this one. And we're going to just look back and forth. Good. And then we're going to look up here. And look in there. And then oh, what's that light doing? What's that light doing? Good girl. Let's take a look with my other big lens. Here we go. Ready? Come on. Here we go. Good. Sarah, peekaboo. This one. Yeah. There we go. Good girl. And let's do the other right. Sarah. Uh-oh. Sarah. There we go. Good job. Yeah. Ready? Sarah. Here we go. Good girl. There we go. Woo, woo. Good girl. Woo, woo, woo. Ready? Sarah. Look right there. Look at that doll. Good girl. Very good. And let's look at this one. Good job. Let's take a different one. Ready? Good girl. And another one. Here it comes. There we go. Good girl. Good job. And then we're going to put a little drop in each eye. Come here. Okay? And we have something to suck on already, huh? Right with her eyes closed, just like
Good
that.
Good girl.
And a little bit there. And
Good
let her rub.
girl.
You can just sit her up and let her rub.
Good
Want to rub
girl.
those eyes? Go ahead. Good girl. And then we're just going to wait a little bit while those drops work, and then we'll come back in and take a look. Okay?
Okay.
Thank you. Hello, Enbud. Hello, Enbud. Good job. Oh, good girl. Good job. Very good. Let's go to the other eye. Ready? Here we go, baby. Ready? Good, see, good. Okay, you did a great job. Good work. And so eye health is normal. There's no sign of any disease, no abnormality at all. Vision development is right on target, right where it should be. See, she's happy about that. And so no signs of any problems right now. She's a little tiny bit farsighted, and we expect that at this age. There's lots of changes in refraction during that first year, and so we'll just watch carefully and make sure it stays within that typical range where it should be. We'd like to see her again at about 18 months. That's when we see a high incidence of eyes tending to wander. Again, at 2.5 and 3, there's another stage where we see big changes in vision. And then, of course, we'll check her again before she gets into kindergarten. So make sure she's developmentally ready for success in school. I also have a pamphlet for you that has some information about things to watch for. So if you see any signs or symptoms of things that you read about in here, bring her in right away, even if it's in between those scheduled appointments.
Okay.
Any questions?
No, I think that's good. Thank you.
You did a great job. You too. Good job. Thank you very much.
You want to read this?
Yeah. Let's go back and review each procedure. How is it done, and what are we looking for? Once mom and baby are settled, talk to the baby so she can get comfortable with you. There we go. All right, so we're just going to go through each thing. Play a game, something familiar with a bright light like peekaboo, something exciting. Peekaboo, peekaboo, peekaboo. Good girl. And we just look right at that light. Good job. Peekaboo. Once you get her attention, then you can cover one eye with either your hand or a thumb to look at angle kappa. And with both eyes open, look at angle Hirschberg and see how the eyes are aligning. With another toy. If the light becomes boring or too bright, switch to a bright light toy, a finger puppet. And that's okay if she touches. Yeah. Oops, you got it! Yeah, let's do it again. And now we're going to do it with a thumb. Can you see that there? You buy a hand, okay? Cover test allows you to determine eye alignment and motor fusion. Ready? Here we go. Do you want something to give? It's a little big. Let's give you this one. Okay. Now we have both hands occupied. Ready? Here we go. Sarah! Boop. Look right there. Good girl. Look again. Here we go. Good girl. Look again. Here we go. Good girl. To check muscle fields, you want to use a visual and auditory target. So we have both modalities attracting her attention into every position of gaze. Another way to accomplish this would be for mom to hold her head still while you move the target into all positions. Ready? Or to hold the target still and have mom move the baby's head up, down, left, right. The goal is simply to make sure the eyes can get into each position. When we're looking for visual pursuit tracking, we want to use a quiet target, one that does not have auditory stimulation. Again, we can accomplish this by moving the target into all positions of gaze with mom's help to hold the baby's head still, or we could have mom move the baby's head while the target is held still. Good. Convergence can be tested both with a noisy target and with a visual target. A lighted target on the end of your transilluminator is an excellent source. Good. The visual target makes it easier to see eye alignment as the target is moved closer to her nose. Good girl. Very nice. Ready? Look at this one. 10 base up prism test is used to determine if the baby is paying attention through both eyes simultaneously. Good girl. Let's get another. When looking through both eyes and one is covered by a 10 base up prism, the baby sees two images. You can see the eyes switch from one image to the other by moving up and down depending on her attention. This one. Confrontation visual fields are best accomplished with a combination of noisy and quiet target. A noisy target to initially attract her attention centrally allows you to introduce a very enticing peripheral target and see if she can switch her attention from one to the other. Oh, once you touch it. When she has been able to do that in every position of gaze, you know that the confrontation visual field is intact. Be sure to give the baby enough time to respond, so you know that they really can see in all fields of gaze. The Bruckner test is completed in a dark room with your ophthalmoscope light lighting up her entire face. You look at the response in each pupil for media clarity, indications of strabismus, amblyopia, or significant refractive condition. By judging the reflex from each eye, symmetry, brightness, and clarity, you can determine a lot about how this infant is functioning. Here are a number of examples of how the eyes might appear in different conditions.
Let's look at this one.
Because babies are so interested in your light, pupillary responses are easy to read.
Oh, what's that light doing? What's that light doing? Good girl. Come on.
Using your transilluminator light in combination with your BIO 20 diopter lens allows for excellent magnification when evaluating external eye structures.
Sarah. There we go. Good job. Good girl. There we go. Good girl. Ready?
Mohindra retinoscopy is the most appropriate form of retinoscopy when working with infants. Again, this is completed in a dark room with monocular viewing.
Ready? Sarah.
With your retinoscope at 13 inches, occlude one eye and introduce lenses as needed to neutralize the reflex.
Good job. Let's take a different one. Ready?
Right on this.
Good.
This can be accomplished by using your hand to block the eye not being tested,
Girl. Good job.
or by use of a patch or occluder.
And now you probably do want to hold her hands down a little bit. There we go. And let's
Good girl.
While loose lenses may allow for easier retinoscopy, a skiascopy bar can also be used to judge the initial starting lens.
Here we go. We may have to hold those hands. Okay. There we go. Good girl. Good. And let's take a look. There we go. Good job. Oh, look at that girl. Good job. Very nice.
When introducing drops to the infant, it is not necessary to have their eyes open. Simply introduce the drop with the eyes closed to the nasal canthus. The baby will do all the rest, opening her eyes and rubbing the drop in.
While those drops work, and then we'll come back in and take a look.
Monocular or binocular ophthalmoscopy is the easiest way to perform a dilated fundus examination in infants. If your baby is too fussy to complete the examination, remember to always end on a happy note if possible and reappoint for another day. If findings are normal, advise the parents regarding general visual development and when follow-up examination would be appropriate. If you have detected eye health problems, schedule appropriate consultation and initiate treatment. If you have detected vision problems, reappoint for further evaluation. If the baby can fix and follow equally and has no aversion to occlusion, you can infer that vision is not significantly different between the two eyes. If you suspected a significant difference in monocular response, there are special tools available to evaluate vision in infants. Referral for that evaluation may be appropriate based on what your findings are. Remember that infant vision can change significantly, and you want to be sure your findings are consistent over time before prescribing any lens which may interfere with emmetropization. Do recommend visual stimulation activities, especially emphasizing the more ametropic eye to encourage visual development.